Assalamu alaikum everyone. I hope everybody is doing well. Welcome back to my YouTube channel. My name is Wania Zaidi. I'm a nutritionist. So before jumping into the topic, I would like to show you this new place. This is not my home. Actually, I'm standing somewhere else. Such a pretty place. If you are from Riyadh, do tell me what is this place. Okay, so जो आज का मेरा topic है वो है hypertension. What is hypertension? It is a condition when the force of your blood against the walls of your arteries increases, and that can cause some health issues related to CVDs. Especially इसमें heart diseases बहुत ज़्यादा commonly exist करते हैं. Okay, so if we talk about how we measure blood pressure, there are two numbers. One is systolic, other one is diastolic.
Systolic blood pressure is when the heart contracts, and diastolic blood pressure is when the heart relaxes.
The normal range for systolic blood pressure is 120 millimeters of mercury, and for diastolic it is 80 millimeters of mercury. Now, if you're not falling into this normal range, if your blood pressure is not falling in this normal range, there's some increase in the value which is given here. You can see on your screen that there are three values given related to pre-hypertension, then there is hypertension stage 1, then there is hypertension stage 2. You can see all the readings here. If these readings exceed to 180 for systolic blood pressure and 110 for diastolic blood pressure, then you need to go to the emergency care. If I talk about complications related to hypertension, there are many complications that are related to hypertension, but most commonly there is kidney damage, then there is heart disease, then there is enlarged heart. Patients with hypertension can experience blindness. They might also experience severe headaches. Okay, so if I talk about risk factors of hypertension, then there are some related to diet and some are not related to diet. So first I would like to talk about the risk factors related to diet. The first one is high amount of sodium in your diet. That means if you're taking more salt in your regular day-to-day life, then you're at a risk of developing hypertension. Second one is deficiency of potassium in your diet. Third one is deficiency of vitamin D in your diet. Okay, so if we talk about risk factors other than diet, then there is obesity. There are great role of your genes. If your ancestors had hypertension, then you are at a risk of developing hypertension. Third, very important factor is stress, overthinking. Fourth one is less physical activity in your daily routine. Okay, so now I would like to tell you what are the dietary measures you can take at home to treat hypertension. Always remember, if you're somebody who has hypertension, you should always follow a diet that is low in calories, has less fats, medium amount of proteins, higher amount of complex carbs, has less sodium and more potassium. Okay, so for the patients of hypertension, there is this diet called as DASH diet. It stands for Dietary Approaches to Stop Hypertension. Okay, so according to the DASH diet, you should take meals that are higher in grains, beans, vegetables, and fruits. You can also take poultry and fish. You can also add seeds, oils, and nuts in your diet. There is no restriction of dairy products. Yes, you can only take them if they are free of fat or has a low amount of fats. There are foods which you should completely avoid if you're a patient of hypertension. First one is red meat or any fatty part of meat. You should completely avoid it. You should take less amount of salt in your daily diet, like cut it to half teaspoon. Keep a very good control on beverages and sweets because they can trigger the issues if they are taken in an inappropriate amount. Okay, so that's it for today. I hope you liked this video. If you liked it, then please give it a thumbs up and do subscribe to my channel. And don't forget to share it with your family and friends and people who are suffering from hypertension. I hope to see you soon. Take care. Allah Hafiz.